We specialize on the primary health care services that can be delivered by family practitioners, pediatricians, obstetricians, internists, and mental health professionals and others like that. We'll provide interpretation in many different languages for the patients who are not English speaking. We will provide assistance with referrals to many different other specialists, and we'll really do some hand-holding at sometimes to help get particularly uninsured patients into the offices of specialists and diagnostic testing centers.
That was scary, you know, to know that I don't have the money, I have cancer, and nobody's going to help me. So I said, I'm going back to where it started from. So I went back to her office because I figured, okay, you do mammograms, you know, you should know somebody that can help me. She was like, look, we're going to find something, you know. And we went upstairs in her office, and she started giving me all these different places to call and all. And the first place she gave me was Mercy Hospital.
She's one of the patients here, and I called Miss Pope, and I continued to call Miss Clarice, as she mentioned, until she got the mammogram.
He can have, because he was in the amniotic fluid and there's all that gunk in there, and it can clog up the tear duct. So
really, the population that we serve, we're going to be located in low and moderate income areas. Most private practices for their own survival need to serve primarily commercially insured patients. Our health centers are located in areas of town where those kinds of coverages are going to be less available to patients, so we end up serving a larger proportion of people who don't have any insurance at all, which is roughly about 25% of our population right now.
Come on. Yay, Munchkin. Yay.
Our goal is to keep people healthy in the community. When chronic diseases go unchecked, or when patients are not even diagnosed, knowing that they may have a condition like cancer, if we can catch that patient early enough, detect the disease, treat the disease either through ourselves, medication if possible, but in the case of cancer, through intervention of a specialist, a surgeon, or other specialists who can correct that situation early on, that patient has a better chance of living, first of all, and living in a more functional way, second of all.
And she be checking to make sure, you know, how you doing, you know, and that means a lot. That's why when I was saying about the caring part, you know, you don't need to be in a business like this if you don't have no type of caring in your heart for people.